I am a researcher and a clinician, so I work at Flinders University here in Adelaide, conducting research about living with dementia and service provision for people living with dementia and their families. But I also work as a psychologist in private practice a couple of days a week as well. And so today I thought that I would take a mostly clinical approach to this webinar and be quite practical in terms of talking about strategies and approaches to maximising mental health when you're living with dementia, rather than boring you with lots of research details. But, you know, I do acknowledge too that I'm not living with dementia, and I haven't cared for a person with dementia for a while now. And so I really welcome people to kind of jump in or correct me if they feel like I'm wrong or whatever, because, you know, I recognise I'm not the expert here. You all are. So let's go for it. Okay. Right. So I guess I'll start with some things that most of you would probably know, that developing symptoms of dementia and being diagnosed with dementia can have you know, really wide-reaching impacts on our psychological well-being. We know that people with dementia report that having a diagnosis affects their self-identity, their sense of who they are and what they contribute in the world. We know that dementia can limit a sense of control over what's happening in your environment, in your own brain, in your own body. It can affect your sense of status in the community because, you know, a lot of people with dementia, especially people with young onset dementia, are often at kind of the peak of their professional lives or of their family lives. And these things can happen that when these symptoms happen, that can really affect their kind of role in that community and force them to compromise things that maybe they don't want to do. Obviously, dementia affects your hope and plans for the future, that the future doesn't quite look the way that you thought it was going to look. None of us expect that we're going to develop dementia. Big impacts on our social relationships, which I'm sure you would have talked about in these webinars many times before, and the way that dementia can affect friendships and can affect other relationships. Just realised that I'm very bright and shiny on this screen, aren't I? I'll try and turn my light away a bit. The other important thing that dementia can impact is what's called emotion regulation. So emotion regulation, for those of you who haven't heard of this term, is basically our ability to calm ourselves down. And so if I am driving along on the street and somebody cuts me off, my emotion regulation skills kick in and tell me to not to ram up the back of their car, not to give them the finger and scream at them, not to get out of the car and try to abuse them, because I recognize that that doesn't actually help me in the long run. It doesn't really help them. It doesn't actually solve the problem. What my emotion regulation skills do is help me to bring myself back to calm, bring myself back to the room and move on with my day. Dementia can affect these skills, especially dementias that affect the frontal lobes of our brain, things like frontotemporal dementias, can really affect our emotion regulation skills. So it can be very difficult to kind of calm down when we feel upset and when we feel distressed. And then, of course, there's also the economic and other stress that comes with having dementia. It's expensive to have dementia. And then beyond all that, then you have to deal with the really complex systems and the stigma and, you know, people really not providing the kind of care that you need. So it's not really surprising that dementia can have a pretty significant amount of psychological well-being. But at the same time, there's also plenty of evidence telling us that dementia can be a real opportunity for psychological growth. It is certainly a test of resilience and is an opportunity to develop our skills in resilience and coping. There's an opportunity with dementia for meaningful role change. The roles in your family, in your friendship circle, in your workplace may change, likely will change, but that can be in a meaningful way and can be in a way that is still fulfilling for you and for the other people in your circle. It can also, it's almost always associated with improved problem-solving skills, because, as I'll talk a bit about later, people with dementia are expert problem solvers, because, you know, the goalposts are always changing and we're forever having to pick up and figure out how to solve new problems that present themselves. And so people with dementia and their families tend to get really good at problem solving. And it can also be an opportunity for deeper social connection if we let it be. So I'm going to talk about that a little bit later as well. But what we do know about people with dementia is that they report very high rates of psychological disorders. So about 25% of people with dementia meet the criteria for major depressive disorder, which is characterised by low mood, loss of interest in activities that used to be enjoyable, things like apathy and reduced concentration and irritability. These are all classic signs of depression. And that is about 4 to 10 times as high as older people living in the community who do not have dementia. So depression is very common among people living with dementia. And 14% of people with dementia meet the criteria for one or more anxiety disorder. So anxiety disorders are characterized by feelings of panic, feelings of worry that you know, can be persistent and really damaging and distressing. And this is more than the about 10% of people not living with dementia who report an anxiety disorder. We also have some recent evidence telling us a bit about people with dementia who have experienced traumatic events in their life. So traumatic events could be anything from you know, a motor vehicle accident or a natural disaster or some kind of assault or abuse. Even where the symptoms of traumatic responses have been dormant for many years, we do have some emerging evidence now that people with dementia can experience a re-emergence of these symptoms after the onset of their dementia symptoms, which obviously is a really distressing thing. So there are these real risks to psychological well-being when we develop dementia. And the other thing that is very relevant here is that very few people with dementia, at least in Australia, access psychological support or other mental health support. It's very unusual to come across a person with dementia who's managed to access psychological support, at least here in Australia. And part of the reason is that there really is a lack of workforce expertise. So here in Australia, the estimate is that only less than 6% of psychologists have an interest in working with older people, and even less than that have experience and interest in working with people with dementia. And part of that is a two-way problem in that there's not a lot of information and kind of content delivered in undergraduate university programs about older people and people with dementia for psychologists and other mental health professionals. But on the other side, psychologists don't often get referrals from dementia care services or from people with dementia themselves because of this. There seems to be a disconnect in understanding that actually there's a real need here. There's also what you would have heard many times, I'm sure, known as nihilism among professionals sometimes, that, you know, what's the point? This person has dementia, that they can't engage in cognitive therapies or talking therapies, which, as I'll talk about a bit later, is really not true. We've also seen some quite significant generational changes over the last, you know, few generations. My generation, which, you know, is geriatric millennial, I've just learned that's the name for my generation now. So my geriatric millennial generation, we are really good at talking about our feelings and being open about the way that we feel, about accessing services and supports. But you would all know better than I do that that has been a change over time. My clients who, you know, were post-war or baby boomers or any of those generations, it wasn't normalized. It wasn't a normalized thing to talk about the way that we feel and to talk about it when we're struggling. And so what I'm certainly noticing in my clinical practice is that as my clients get younger, these concepts get a bit more familiar to them. And of course, loneliness and social isolation contribute to all of these problems as well. As I mentioned, when our relationships and our friendships change, that can affect how lonely we feel and how socially isolated we are. So that's the kind of depressing stuff over, I suppose. Let's talk now about what we can do about it. So you might have heard before about self-determination theory. So self-determination theory is a very popular and widely used theory in psychology to understand what it means to be mentally well and what are the key things that we need in our lives to be mentally well. And the great thing about self-determination theory is that these psychologists have managed to distill all of the different things that we need as human beings into three concepts. So the first one is autonomy. To be mentally well, we need to have a sense of control over our own behavior, over our environment, over our goals, over our brains. So that's really important. We need to sense, at least at some level, that we have control over what's happening around us and we have autonomous choice in our lives. We also need to feel a sense of relatedness. So we need to feel a sense of belonging and attachment among the community around us in order to feel mentally well. And the third one is competence. So we need to have a regular sense of achievement, of mastery, of feeling like we are good at something, we're contributing something, maybe isn't the right word, but I guess what I mean is we have to feel like it's meaningful for us, that we are doing something that makes us feel like we have achieved something and that we've mastered something and that we are making a meaningful contribution to whatever it is. So this can kind of shape our understanding of everything else, that we know that just because you have dementia, these three concepts are still very true. These are the three kind of key elements of living a really mentally well life. And so what it is then is taking steps every day, making micro decisions every day that lead us in the direction of these three concepts. So what I'm going to do is basically talk about a range of different strategies or concepts that can support people living with dementia, their families, and even professionals working with people with dementia to maximize their mental well-being. Some of these will be very familiar to you and it will be like, you know, going to the GP who's always nagging you to do some exercise, but others might be a bit more new and we'll talk about them in a bit more depth. So let's jump into doing that. So the first thing is activity. And this might seem like the most captain obvious thing in the whole world, but what we know about depression in particular is that withdrawing from activities that we used to enjoy and not engaging in those activities is often a big risk factor for depression, and is a big maintaining factor. Almost all of the clients who walk through my clinic door with depression are not doing enough. They're not getting out the door enough. They're often sitting and doing things that are mindless, like scrolling on their phone or watching television or listening to the radio or whatever, rather than getting out and doing things that make them feel happy and engaged. The biggest problem with this is that the less you have to do, the less exposure you have to pleasure and achievement. And these are really essential elements to just what we talked about before, to living mentally well. You don't get the opportunity to get out there and see that life is happening around you and that there's opportunities for pleasure and achievement, even when things are not going so well. The other thing that's really killer about inactivity is that the less you do, that often means more time ruminating. So ruminating is a kind of thinking that it's kind of like, you all would recognize it. It's a sort of thinking that's kind of like a downward spiral. A lot of the time it's sort of why thinking. Why did this happen to me? What did I do wrong? Why is he acting like that? Why do I have to be going through this? This kind of repetitive thinking that has no resolution, it has no answer for you. And what the problem with rumination is that it can spiral really quickly. It can start with, why did I have to develop dementia? End up with, why am I alive? You know, it can really escalate quite quickly and really take you to quite a dark place and be difficult to wrench yourself out of. And when you don't have enough to do, it's very tempting to engage in this kind of thinking. And so it's very important to not give your brain the opportunity sometimes, especially if you are experiencing depression or if your mood is quite low. In those moments, the depression wants to feed itself. It wants you to sit there and be miserable and think about all the terrible things that have happened in your life. And so your job, and you and your family or whoever, your psychologist, your job is to fight against that and do the opposite of what the depression wants you to do. So I tell my clients to try to pee every day. And what I mean by that is to make sure that there is an opportunity to experience pleasure, to experience achievement, and to exercise. Often we, in the clinic, will actually schedule this out with people. Actually, I think I've written that here. That every day, our clients have to schedule something in that will provide pleasure, something that will provide achievement, and something that will provide some kind of exercise. Doing that every day, scheduling it, even if you feel like you really don't want to do it, is really important for kind of picking yourself up and maintaining your psychological well-being. So that's a nice little acronym you can stick on your fridge, to pee every day. Okay, this is where I think I might lose some of you, because it's like, oh God, she's telling us to exercise again. But I thought I would just kind of echo what you would have heard a million times, that as well as being good for everything else, exercise has a very large effect size in reducing depression and anxiety in people living with dementia. And bigger effect sizes than psychological therapy, than almost anything else. Really, exercise for people with dementia and people without dementia is one of the most powerful treatments for psychological disorders, and is one of the most powerful ways to maximize mental well-being, no matter who you are. So, which sucks, because I don't really like exercising, but unfortunately it's something that, that helps. So a couple of years ago, some researchers did a very big systematic review and meta-analysis of things that got in the way and things that were helpful in supporting people with dementia to do more exercise. And some of the things that were reported by people with dementia or their families as quite helpful to help get them out exercising is, firstly, very obvious, do something that you actually like. I often tell the story of my mother, who does a Sudoku every morning because she wants to slow down her cognitive decline, but she hates Sudoku, so she hates every minute of doing this thing. And so what is the point? I mean, that's really defeating the purpose. So, finding something that is enjoyable for you. It doesn't have to be going out for a walk or a run. It might be dancing around your living room. It might be gardening. It might be golf. It might be anything that just gets you moving and gets your heart pumping. It can be very easy to feel discouraged by what you can't do anymore, or what, with or without dementia, I can't do the level of exercise that I used to be able to do when I was younger. And that's true for all of us usually. And so it can be important to maintain a focus on what you have achieved, what strength you have built since you last did this exercise, how much fitter or faster you might have gotten since that last time. A lot of people with dementia talk about pets being helping them get out to exercise. If your dog needs to go for a walk, you kind of don't have a choice but to take them out for a walk, and that's certainly true in my life. So sometimes, if it's safe to have a pet for you, that can be a helpful thing to do, is to sort of prioritize their needs, I guess, and then you get the secondary benefits of that. Scheduling stuff in, I just mentioned this, that a lot of the time we just need to do the work of scheduling it in, and that's enough to get us out of the house. And then obviously joining groups or getting an exercise plan from a physio or many services offer this now. And if you have trouble, if you like going out for walks or getting outside and you have trouble finding your way, the technology is quite amazing these days and can help you to stay safe and move around safely. Whoops. All right. I should probably check the chat, shouldn't I? Because I haven't done that yet. Whoops. Oh, here it is. Sorry, I'm going to move it off the screen. Yeah, excellent. All right, nothing urgent there, I can't see, that we can't come back to a little bit later. All right. So the next one is another pretty obvious one that, I'm not going to spend too much time on, but as you would all know, that continued social engagement is very good for both our psychological and our cognitive health. Socializing is one of the most challenging cognitive tasks that we can do, because if you think about how many faculties we need to engage to be able to socialize, we have to know how close to stand to the person. We know how we have to listen and remember what they're saying. We then have to come up with a response that makes sense. There's a lot of intricate cognitive tasks that take place when we're socializing. And so continuing that engagement can be really good for our brains and to slow the progression of the cognitive symptoms of dementia. But of course, social roles may change and there may need to be work done between you and your friends or your family members to search for new meaning there. And it can be really, really challenging, and allowing yourself to recognize that this is really difficult stuff to have those roles change, and that it can take time. It can take time for everybody to sort of get used to those roles changing. There can be opportunities to educate other people about dementia, which may be more for some people than for others. Some people may not like to have to do this, but that can foster closeness and a shared intimacy, being frank about that, being frank about your disabilities and the way that these things affect you. When a person looks at you and cannot tell that you have dementia, sometimes we need to be more explicit and be vulnerable. Take the bravery of being vulnerable to share frankly about what our disabilities are and how that person can support you. And of course, seeking out other people with dementia, as Dementia Alliance International is, that's the whole point, isn't it? That nobody really knows what it's like except for people living with dementia. So, and we know that counselling, support groups, those sort of opportunities to get together with other people with dementia have a big impact on quality of life and make it easier to feel socially connected. Okay, so enough about the more obvious stuff. Let me talk a little bit about psychological therapy for people living with dementia. So if any of you have any preconceptions that psychological therapy is not possible with people with dementia, or it's not successful or useful, I want you to throw all of that out the window right now, because we have good level evidence now that cognitive behaviour therapy is effective for treating depression and anxiety in people with mild to moderate dementia. Cognitive behaviour therapy is the most common type of therapy that's delivered by psychologists. It's sort of the basis of all of the therapy techniques that we work with. So, and I'll talk a little bit about what cognitive behaviour therapy is in a minute. So it's delivered very widely to most people living with depression and anxiety, and we know that it's effective for people living with dementia as well. There's also a therapy called problem-focused therapy that was developed specifically for people with dementia and their families. And the idea is to support the person living with dementia and their families to learn structured problem-solving skills, because dementia presents change so often. Things don't stay the same for very long. It can be very helpful for people with dementia and their care partners to learn these structured problem-solving skills. Okay, the goalposts have changed again. What do I do next? Validation therapy is another one was designed or developed for people with more severe cognitive impairments, and focuses on validating natural reactions. So it recognises that if I'm distressed because my ability doesn't match what I want to do, that's completely normal and that's completely justified. And the idea is to support the person to feel calmer, to reduce their distress, to feel comforted and cared for, rather than in cognitive behavior therapy, we might work more on trying to understand what are the thinking styles and maybe changing some of the thinking styles. Whereas when a person has very severe dementia, we might focus more on that supportive care and validating sort of role. And then mindfulness approaches, you all might have heard about mindfulness as being a sort of a third wave approach that's been becoming very, very popular lately. And there's some evidence emerging that these approaches can help people with dementia to accept and adjust to change, which is happening all the time. So we will talk a little bit about that a bit later. So first, let's talk about thinking styles and the way that thinking styles can impact the way that we feel. So this is a really important, the basic tenet, I suppose, of cognitive behavior therapy is that our thoughts influence our mood and behavior. So a lot of people think something happens and then suddenly I feel sad or I feel angry. You know, somebody cuts me off in traffic and I'm angry. These things happen instantly and they're completely connected. But actually it's the thought that happens in between that affects the way that we feel and what we do then. So if somebody cuts me off in traffic and I think to myself, oh, what a jerk, you know, how rude, he doesn't respect me. I can't believe that he's just done this. I'm likely to feel quite angry and sad and upset, right? But if that person cuts me off and I have a different thought, which is, oh, well, I'm not in a rush, everything's fine, whatever, I'm likely to feel less stressed out. And so that's the kind of basic idea of cognitive behavior therapy, is that if we can learn to catch this thought that happens in between and replace it or amend it a bit to be more helpful, that can actually have a really significant impact on the way that we feel. Our thinking styles, we all kind of come through the world with thinking styles that can be unhelpful. So, you know, this list on the side here, you may want to have a look through and have a think about whether you are likely to do any of these things. So, you know, I am pretty well known for my catastrophizing, that something happens and I tend to jump to the very worst possible conclusion. But we all of us do some of these things to some extent. So things like jumping to conclusions and thinking we can read people's minds. The tyranny of the should is a really common one, that we should be like this, we should be like that, we must do this, we ought to be able to do this at this point. And the problem with should commands is that there's no limit to this, right? We should all be doing something better, but what's the reality right now? And so working or practicing noticing and replacing these ways of thinking with more helpful alternatives can be really helpful. It can be difficult when you have dementia, especially if you have types of dementia that affect your frontal lobes. It can be quite difficult to do some of this stuff. And so sometimes it's better to focus more on what's called behavioural strategies, like being more active, making sure you're engaged in regular activity and exercise. But many people are able to engage in this kind of work as well. And so this also applies to dementia. We all have beliefs and thoughts about dementia that we carry with us. You know, we do live in this world that stigmatizes dementia. We all kind of come through the world with these beliefs about dementia, and that doesn't stop when you develop dementia. You have all come to your diagnosis of dementia with pre-existing beliefs about people living with dementia and what dementia is about. And so those beliefs can affect the way that you feel when things happen. So for example, if you came through the world with this belief that, look, people who repeat themselves all the time are really annoying and people don't like to be around them. And then you have an outing planned with your friends, you've developed dementia and now you're supposed to be going out with your friends. And that's the thought that you're coming through with. That's likely to lead you to sadness, to despair, and to withdrawal. Another example, if the belief I have is that people with dementia all forget their family, this is just inevitable and this is going to happen to me. And and then you notice that you've forgotten a friend's name, you're likely to feel really anxious and panicked about this. This is the start of it. I'm going to forget all of my family. I'm going to forget all of my friends. And so that's going to be really distressing. But if we work to amend some of these thinking patterns to be more helpful, you can replace them with things that are more helpful. So all of my friends are repeating themselves these days, which is probably true. Then you're more likely to go and engage with this outing and have more fun. If you forget a friend's name and the thought that you have is, well, I haven't actually seen this friend for a really long time, you might be a little bit embarrassed, but mostly you'll be able to feel calm. And so the idea here is not to be Pollyanna about it and sort of, we've got to look on the bright side or be really positive all the time. That's not the idea at all. The idea here is to practice thinking in ways that are helpful. Helpful is the key word here. Is it helpful to me to think that, that all people who forget themselves are really annoying? Probably not. It's probably more helpful to think about how lots of people are repeating themselves, about how, you do have disabilities, and that if you needed to use a walking stick for a disability in your leg, that would be fine. And so, thinking in ways that are adaptive and helpful for you can be more effective. It's also really important to test out your unhelpful beliefs or your fears. So a really common one that I come across a lot is my friends will abandon me if they learn that I have dementia. I met a man the other day, in fact, who had just been diagnosed with dementia and had pretty much withdrawn from just about everything, all of his social activities, because he was really fearful that, his friends would judge him and abandon him if they learned that he had dementia. And so what that meant was that he was staying at home a lot. He was doing lots of ruminating. He wasn't really getting the pleasure of being with his friends and family all that much. But when we kind of started talking about this and investigating it a bit, it turned out that he actually didn't know this for sure. He didn't actually know this for sure. He had assumed this because he had heard this about other people living with dementia, or he'd seen it with one of his friends. This had happened. And the reality is that abandonment can be real. It can be, it is a reality that a lot of people have to face. But in this person's case, he hadn't yet actually tested this out and hadn't actually experienced this for himself. And so I asked him, how do you know? And he couldn't really tell me. And he noticed that this belief was really getting in the way of him living well. And it was important for him to actually go and find out if this was true, because maybe it is true and that's terrible, but also maybe it's not true. Maybe it's not true, and maybe he's missing out on life because of this belief that actually isn't true. I asked him to test it out and look for some evidence about whether the fear would hold up in a court of law, because that's the kind of evidence we're looking for here. We don't just want, oh, he looked at me a bit funny. We want actual evidence that my friends are going to abandon me. And what can be really important, especially given that abandonment can be real and some people are not good friends when you have a diagnosis of dementia, is to use a hierarchy and start with somebody that is easy. Start with exercises and tasks that are a sort of easy place to start. Somebody that you think, I think they'll be okay with it. I think that they'll be supportive. And then you can sort of go from there, because when we have a fear like this, it's important not to try and go for the hardest possible rung on the ladder, right? Because if we get that confirmation that we were right, we may never try again to have this conversation with another person. And so working through a hierarchy can be an important thing to do. So if you have beliefs about your own dementia or the dementia of a person that you're supporting, it's important to test them out. If they're getting in the way of you living well, don't let the fear of them being true stop you from living the life that you want to live. And also don't underestimate your ability to cope. That is a sort of very common thing that people with depression, anxiety, and other psychological disorders do a lot, is that they have this feared outcome, this thing's going to happen and it's going to be terrible. And then they also think, I can't cope with it if it happens. But actually, we've all dealt with terrible things and survived them and worked through them and become better people because of those things. And so our ability to kind of test this out and recognize our own ability to cope with that is really important. Another sort of common psychological approach that can be taken with people with dementia is reminiscence, and you might have come across these kinds of ideas before. The great thing about reminiscence is that it capitalizes on strengths in long-term memory. So almost all people with dementia will still have strong long-term memories, and we can capitalize on that for our psychological well-being. So any opportunity that you have to reminisce, to go back into comforting long-term memories that make you feel good, that's a really great thing to do for your psychological well-being. Recommend, engaging all of your senses, any perfumes that you used to wear or your mother used to wear or whatever, any kind of flowers that remind you of special times, going through photo albums, scrapbooks, old newspapers or mementos. These are all can be really fulfilling and positive things to be doing. And sharing those experiences. Often our family, our children and grandchildren really love hearing some of these stories. So really engage with that and lean into it if it's something that interests you. Okay, mindfulness. I have a feeling that most people here would have heard about mindfulness. It is definitely the craze right now. It's very, very popular because it is really accessible. Or everybody can practice mindfulness, no matter what kinds of cognitive impairments you might have, no matter where you live. Mindfulness is really accessible for everyone. So mindfulness is the practice of purposefully bringing your attention to the present moment without judgment. It's based on, the simple fact is that neither the past nor the future are within your control. You cannot do anything about the past or the future. The only thing that you have any control over is what's happening right now. And so particularly when we feel depressed, we do tend to go back to the past, try to understand things that have happened, try to think about what we would have done differently and all this kind of thinking, but we can't actually change what has happened. When we are anxious, we tend to look to the future a lot and worry about things that might happen or we think are going to happen and it's going to be disastrous, but we can't change that either. All we can do is control what's happening right now, what I'm doing right now in this present moment. So let's do a very quick practice of an exercise like this. So this is a good example of a mindfulness exercise. And the idea of an exercise like this is that when we're doing lots of worrying or we're doing lots of thinking about the past, we're in our head, right? We're very consumed in what's happening inside our own mind. What the idea of this exercise is to bring us back to the present, to the room that we're in, to recognizing that I'm still here in my body and I'm not stuck in my brain. I don't have to keep thinking about this. So you might like to join me in doing this together. So the first thing is to have a look around you and just make a note of 5 things around you that you can see. Just a mental note. What are 5 things that I can see in this room? I can see a light switch and a painting and a drink bottle anything else you can see. And then I want you to bring your attention to 4 things that you can hear around you. I can hear a car going by on the street. I can hear my own voice. And what are the 3 things that you can feel around you? I can feel the seat under my bum. I can feel the material of my pants. Try to notice 2 things that you can smell. I'm not sure what I can smell in this room. I can sort of smell fresh air, I suppose. And lastly, take a big swallow and notice what you can taste. I can taste my toothpaste from brushing my teeth this morning. And so this exercise is a really simple thing that you can do anytime, any place, when you are noticing that you're stuck in your own head and you're feeling quite distressed. If you're feeling upset, if you're feeling angry, if you're feeling sad. And so bring yourself straight back into this room. I am in this room, I am safe, everything is okay in this very, very moment. Breathing is a big part of mindfulness. So anybody who's done any kind of mindfulness practice would know that a lot of it has to do with breathing. Because slowing and paying attention to your breath can reduce how distressed you feel. It takes a bit of practice. I struggle sometimes with breathing because I'm quite an anxious person. And so when I'm really worried about something, I find it difficult to slow my breath and calm myself down. But certainly with practice, I've gotten better at this. And I've just seen somebody in the chat mention that this is a good thing to do when there's something that you're worrying about. And absolutely, for sure, these are really good things to do when you feel worried. So box breathing is super simple concept where you simply breathe in for 4 seconds, you hold it for 4 seconds, you breathe out for 4 seconds, and then you hold that for 4 seconds, and over again. Very simple, but what it does is it allows your breath to slow down. It allows you to get centered into your body. And it's quick, you know, you don't have to remember any difficult instructions. It's just 4, 4, 4, 4. I was going to kind of take through a practice of a progressive muscle relaxation too, but in the interest of time, I won't do that. But basically the idea, you know, and you can Google this on YouTube or whatever, the idea is to learn how to let go of the tension in your body. So piece by piece, you will take tension into a part of your body, maybe your hands, and clench them really tight, and then feel the feeling of letting the tension go and letting the relaxation come over you. Okay, another important aspect of being mentally well is goal setting, and I'm sure that you would have all, you'd probably all be more experts in this than I would be. But of course, goals and achieving goals helps us to maintain a sense of mastery and autonomy. And I recommend taking a stepped approach here. So if you have a goal of that's something sort of big, sometimes you need to make small steps that will help build to that ultimate goal. So if your big goal is that I want to continue playing golf regularly, then you might need some small steps before that. So firstly, I need to organise some transport to get me to golf. I need to arrange for a family member or friend to be my caddy. I need to figure out how to keep track of my scoring because that's not my strength. And so some kind of system that can help you get the scoring right might be a shorter goal, a smaller goal, which then helps you towards this big goal. But I'm not going to talk about that too much because you would all be you would all be much more familiar with this than I am. Now, I've talked a few times today about how dementia is progressive, and so the goalposts change all the time. I'm very aware of this, that you might feel like you've got some kind of even keel happening, and yeah, I know what I'm doing, I know how to manage this, and then things will change again, and that can be very, very challenging. And so what it means is that people with dementia are expert problem solvers, and also their care partners can be really good problem solvers as well. Sometimes in session, we actually need to teach people how to do problem solving. And this is people without dementia, just as much as people with dementia. That there's actually, some people are just not so good at going through a structured problem solving approach. And so there are steps to doing this. Often we need to find someone who can help, because we can get caught up in the catastrophe of it all, that there's no solution, I can't do anything, but having somebody to sit there and brainstorm with can be really helpful. Listing out all of the possible solutions, even the ones that are ridiculous, just getting them all on paper is really helpful, and then choosing what's the most practical and achievable. And remembering that this is an iterative process, that the first thing you try may not work, but you can always try again. And this is far, far, far more helpful than that why thinking that I was talking about. Why is this happening? Why do I have to be dealing with this? Why is this person not being very helpful, etc., which is really, what's the phrase I'm looking for? Justified. Like, I completely understand why we do this kind of thinking, because it is not fair, and it is really difficult to deal with people when you live with dementia. But again, we want to come back to what's helpful thinking for me to be doing, what's helpful, what helps me move forward. And I think maybe the last thing that I'm going to kind of talk about in terms of tips is self-compassion. So self-compassion has had this sort of explosion in the last few years of this explosion in terms of psychologists and other mental health professionals really seeing the value in this kind of work, because most of us have quite a critical inner voice. We're usually our own worst enemy, our own biggest critic. And certainly some of the things that I say to myself are horrible, and things that I would never, ever, ever say to somebody else, even a person I didn't like. And so it's not really surprising then that sometimes I feel really bad about myself, because I talk really nastily to myself, right? And so it's very important to interrupt this critical self-talk. A really important question that I often ask myself is, what would a trusted friend say to me in this situation? What kind of care would somebody that I love show to me in this situation? And so by doing this and practicing this, again, this is a skill that takes a bit of work. You kind of have to be quite deliberate about it. And sometimes you might have to have signs up around your house to remind you, be kind to yourself, you know. But what you can do is cultivate acceptance of yourself, that I'm not perfect, and I've made mistakes, and I've embarrassed myself, and there are things I'm ashamed of, but I'm actually okay. And that's okay for me to be just like that, just how I am. To be the imperfect and flawed person that I am is actually an okay thing. That's actually quite transformative, and something that I think a lot of us are not very good at, or very conditioned to think about for ourselves. We walk through the world feeling critical of ourselves and feeling criticized, and I imagine that living with dementia can really feel like that as well. And so cultivating a sense of acceptance for yourself, that I'm okay, I'm a person who lives with dementia and who does it well, and I'm okay. All right, I just want to briefly talk about family members, friends, care partners, supporters, whatever phrase we want to use today. And recognise that caring or supporting, care partnering is a real journey, and it comes with just about every emotion that you can imagine. Obviously, it's very satisfying, but it can also be really frustrating, fulfilling, challenging, distressing, rewarding, etc., etc. It goes on, and certainly my experience of caring for my mum or supporting my mum has I don't think I've ever felt such a breadth of emotions in my life yet. So I know that feeling. We know we have lots of evidence that psychological therapy is effective for treating depression and anxiety in care partners. So again, psychological therapy can be really important and really helpful. But certainly when a care partner comes to me and comes to see me, we talk quite a lot about the hierarchy of needs. So, you know, if you did any kind of psychology in uni or anything like that, you might have seen this hierarchy before. So this is basically the idea that we have very basic needs that must be met before we can kind of move up to the next level. We need to have food, water, and warmth and rest in order to be able to live well, right? We also need to be safe and secure. We need to feel belonging. We need to, you know, and then we move up, and then eventually we can kind of get to this point of self-fulfillment. And so a lot of the time when care partners come into the clinic, I notice that they're actually not really eating enough because they don't have enough time to eat, or they don't actually feel safe in their home, or, you know, there's other things going on. And so we tend to kind of work from the bottom up, that let's get those things sorted out and ensure that you have some of these more basic needs met. Make sure that you have friends that you can talk to and other things like that before we kind of move up to dealing with the more psychological stuff. And I'm sure any care partners here would have come across the term ambiguous grief before. And the way I think about ambiguous grief as it relates to dementia, and this is really relevant for people living with dementia as well, that there is a loss of the life that you had planned for yourself, right? We all have an idea about what our middle age and late life will look like, what our retirement will look like. And when that changes, it can trigger feelings and a process that looks similar to grief. And there's a name for that. It's called ambiguous grief. And recognizing and naming that can be quite powerful, that actually I'm not crazy for feeling these kinds of feelings, that this is a really natural thing that a lot of people with dementia and their families experience. Sometimes we need to accept the uncertainty of things. You know, one thing that I've noticed that care partners tend to do, you know, as a kind of survival mechanism, I think, is inventing answers that, you know, I should know how to do this, I should know how to deal with this, or it should be clear what's kind of happening here. And that just creates more stress, because when things don't happen the way that you plan out, then it feels even worse. And so learning to sort of lean into the uncertainty with the idea that you may never know what's going to happen next can be really scary and vulnerable, but it can be helpful. Finding support and taking a break, and also recognizing that you as a family member and a care partner, you are just as important as the person living with dementia. And so, you know, really important to prioritize time for you, things that you enjoy, which I know would be no surprise to anyone on here. Just very, very briefly, for dementia care professionals, I've seen a few of those on the webinar this morning. In terms of how to identify mental health needs among people living with dementia, remember that a person with dementia might not tell you for lots of different reasons, maybe because of their cognitive impairment, but also maybe because of, you know, they don't trust you, or they don't want to talk about it. It wasn't part of their growing up to talk about feelings. And so you may have to look for signs like withdrawing from things that the person used to enjoy. Apathy, apathy's like, I just don't really feel anything. I don't really tend to get happy. I'm not really that sad, but I'm just sort of in the middle. Teariness and irritability, anger, difficulty relaxing, all of these things can be signs of a person who's sad or distressed or anxious. You know, asking the person is helpful, which, you know, sounds obvious, but often can be difficult to do. even just letting them know that you see signs that they're struggling can be helpful. And talking to families and friends about whether this is out of character for the person. There are tools that you can use to assess for psychological well-being, some depending on how well the person's able to communicate with you verbally. They'll definitely communicate with you using their body language, so important to pay attention. And if you're a therapist, whether you're a psychologist or some kind of other kind of therapist, it's really important to tailor the therapy and the support that you are delivering to people living with dementia. Be very mindful with goal setting and ensuring that goals are really meaningful. I think sometimes we tend to underestimate the kinds of goals that people with dementia can achieve, and so be collaborative about that. A lot of people with dementia really benefit from those behavioural strategies like activity scheduling or behavioural experiments or other things that get them out and moving. Problem solving is really important. As I talked about, it's important to tackle those dementia related beliefs. I've really found that has been a big part of therapy with people with dementia that I've worked with, that these beliefs that we all kind of develop over our lives about dementia don't stop when we develop dementia, and can really impact the way that people with dementia feel. If the person has memory loss, obviously consider things like memory aids and repetition. If the person has other cognitive symptoms, whatever the symptoms, just be creative about managing that, and be flexible wherever you can. I think I've talked enough. So thank you all so much again for having me and to talk about this. I'm keeping an eye on the chat as we keep going, and I see some things kind of resonating with people, other things not so much, and I guess that's the whole point here, is that some things, this is why I've kind of presented 10 million different things. Some things are going to be really relevant for some people and really effective for some people, and some things are not. Some things are just not going to be doable based on someone's cognitive impairments, or even just what they like. I mean, certainly all clients that I see in the clinic, some of them, they all have their own preferences about what we do. So it's really about finding what works for you. And the other thing I see a lot of comments about is that, we are living in this stigmatized world. We are living in a world that is not kind to people with dementia, and that's absolutely true. And all we can do is what we can control. The only person we can control is ourselves. And so trying to kind of focus on what can I do, what's within my control to kind of manage this as best I can. So I'm going to stop talking now.